about a little bit about you and like your history with dental work that you've had done and all of that?
Yes. So my name is Ralph. I'm 75 years old, and my wife died, but I'm actually seeing this nice young woman. She's very nice. She's also a widow.
Okay.
Don't take me for that. And then, but yeah, I'd like to. So my dental history. So with that, I have a partial because I have some teeth missing.
Okay.
And just to let you know, I have some bridges on my upper and lower because I got in a car accident when I was young. So there's that. And so I use my partial. And something that I really do not like about it is really tough on my palate. And I understand that I need to go get a new one because all the other adjustments haven't been successful. So I just need to do that. And I soak it in this CPC solution every night.
Perfect. That's great.
Yeah, and I brush every day.
Okay.
But
do you use a manual or an electric toothbrush?
I'm using electric.
Perfect. That's
Yep.
awesome.
What about flossing?
Oh, flossing. That is a hard thing to do. I don't know. I just can't get that flossing. It's just so irritating. So no, I do not floss.
Okay.
Yep.
Yeah, it's really important to floss with our bridges, so maybe we could show you a few techniques that might help, and we could maybe look into starting to floss, or is that something that you think you'd be interested in?
Oh,
Show
yeah.
you? Okay.
There's
awesome.
also some other flosses. Are you having a hard time getting your hands wrapped around the floss to get in those
yeah.
hard to reach
My
areas?
hands are just they're just not what they used to be, and so it's just hard to get back there.
Okay, well, we have some aids that we can recommend to you to help get in those hard to reach areas with your floss.
Perfect.
And are you still taking all the medications that you listed on
Oh,
today's
yes.
paperwork?
Oh, yes. And just to let you know, I had a gastric bypass surgery about 10 years ago.
Okay.
So there's that. I'm taking some medications for some other things. And then I am allergic to bee stings. So I got my EpiPen right here for you.
But no allergies towards medications that you know of?
Not that I know of right now.
Okay, awesome. So we're just gonna start by just taking a look in your mouth. We're gonna measure the space between your tooth and your gums to kind of indicate how your mouth health is doing and what kind of cleaning we'll need to do today, okay?
All right. Sounds good.
Awesome.
So after we did our assessments, we were checking to see how deep your pockets are, and that's going to tell us how healthy your gums are. We like to see it mostly in the 1 to 3 range, which a lot of your teeth were, but there were a few areas that did measure a little higher than that. You can see up here you have an 8mm pocket, and down here on your lower left is a 6mm pocket. They're mobile in these areas. Right here on the upper right is just a little mobile, but here on your lower molars, you're getting a little bit more mobility, and that concerns us because if your teeth are mobile, it means that you have a little bit of bone loss, and you can see here on the x-rays we took today that you have your bone is clear down here, and we want it to be up here by the crown of your tooth.
Can I do something to get that bone back?
No, bone loss is irreversible, but we don't want it to get worse, and that's why we want to try and go after and fix this right now before it does get worse, because since it is reversible, you don't want to lose any more bone. And so up here you can see that you've lost several teeth because of bone loss, and we don't want you to have the same problem down here.
Okay, sounds good.
So Judith's going to go over what we recommend for treatment.
Okay.
So what we could do is today we'll have the dentist come look at these x-rays, and he'll also take a look at that sore spot you've been having at the roof of your mouth from your partial. So we could do that today. We could probably get started on, you're going to need the deeper cleaning that we talked about.
Oops. Sorry.
And yeah, so we took a picture of that. That's what it looks like at the roof of your mouth. So it does look pretty sore and uncomfortable. So we want to get that taken care of first. And if you'd like to get started on the cleaning, we could do half your mouth today, and then we'll schedule you back whenever works for you to finish the other half, because we will have to numb you up so that we can clean down in the pocket and get everything nice and clean and healthy.
Yeah,
Does
that
that
makes
sound
sense. Yeah, that works out. Thank
Okay, awesome. And then Ashley's gonna show you a product that might help with flossing that will
So-
be good.
you. Okay.
Since you have a hard time getting your hands around the floss and flossing in those hard to reach areas, I'm going to recommend this floss pick that has a long handle. It'll help you get in those back areas that you can't get your fingers all the way in the back of your mouth. So this will be a good product to try out.
Oh yeah.
And you can get this just at Walmart
Oh.
to reach those hard to reach areas.
Yeah, and just keep using your electric toothbrush. That's great.
Do you think a water pick would be nice?
Yes, we do
Okay.
recommend trying to floss, and this is gonna be great.
Mm-hmm.
But yeah, a water pick can be added an additional step to that. We don't want it to
Very
replace flossing,
Okay.
but yes, yeah. If you have a water pick, start using that, or you could get it started.
Alright. Yeah, that makes sense.
So I'm just gonna show you how to use the water pick. So with the water pick, you wanna be careful. You don't wanna have it at the highest setting. It usually will have a little setting right there. You don't wanna have it at the highest setting because you can cause trauma to your gums. So when you use the water pick, you just wanna make sure that it's, I like to put mine between a 4 and a 5. And then you're just gonna use the tip and then squirt it right in between the teeth like this. And then you can also come on the inside and then get those harder to reach areas, especially where we have those deeper pockets, just like that. And we don't want this to replace flossing like we said. You still want to be able to use your floss, and you can use the one with the bigger handle that we showed you. But yeah, this will be a great tool, especially on those deeper pockets.
What kind of toothpaste would you think I should use?
So we would recommend a toothpaste called Parodontax.
Okay.
It's gonna help with your gum health, especially with those deeper pockets that we found. And that's just gonna really benefit your gums and help with all the bleeding that you're having.
That works out. My lady friend would be very happy with my
Yes.
teeth. Yes.
Yes, I'm
Very
glad you're
true.
taking the first step towards this.
Me too. Thank you.
Okay, well, we'll get started.